Suba Ross, and I'm Director of Admissions for Tulane University School of Public Health and Tropical Medicine. Today's guest is Dr. Valeria Paz-Soldan. Dr. Paz-Soldan, would you introduce yourself?
Sure. I'm an associate professor at the Global Community Health and Behavioral Sciences Department, and I was born in Lima, Peru, and then I came to the United States for my undergraduate and graduate education, and I'm based back there again. But my mother is American, my father's Peruvian, so I look and sound American, but I'm Peruvian.
Excellent. Well, I invited you here today because I learned that you are the lead faculty member for the Tulane Health Office for Latin America, HOLA, correct?
Yeah.
Can you tell us about the vision of HOLA?
The vision is to improve health and well-being of global communities, focusing on Latin America through education and research.
Well, how about the mission?
Our mission is to facilitate and foster educational and interdisciplinary research opportunities for both Tulane faculty and Tulane students.
So then there are both types of opportunities, educational activities and research activities, right?
Exactly. Yep.
Let's start with the educational opportunities.
Yep. In the past, I used to offer a 2-week course between 2006 and 2008, but I found that the integrated experience of doing an applied practice experience was better for the students.
Yeah.
So since then, we've been I offer applied practice experiences, independent studies. I have students who come down for a semester to Peru, and I even have Tulane alumni who come down to work on my projects or who get their funding through, for example, the Fulbright Fellowship and work in my office.
That's amazing hearing that even alumni will continue
Yes.
with the project and
It
come
is
down
fun.
and work with you.
Yes.
Excellent. It's a great Tulane family.
Yeah, it is.
Well, you mentioned the applied practice experience, and that is actually part of every student's part of the curriculum to complete an applied practice experience. What types of experiences are available?
I would group them into 3. The first one is I currently have funding for grants, and when students are interested in some of these grants, I integrate them into the projects I'm working on. But the problem is that in 3 months, is a short time to integrate them fully into one of those grants. I also have office workers who are research associates. Some of them are doctoral students who can mentor students if their research skills or interests fall within the research skills or interests of the office worker. And finally, I have students who come down to Peru who have a specific area of research interest. And if that's the case, and I can accommodate them, I try to do that, or at least link them up to people within my network who can help with that.
That's excellent. I love hearing about the different types of opportunities. Then independent studies. Can you give us some more information about recent independent studies?
Yes. In fact, most of the independent studies have been born out of applied practice experiences. When they come for an applied practice experience, the students are often collecting data, analyzing data, beginning to write up their experience. And it is too short a time to actually finish the work. So a lot of times those who are interested and committed to finishing, we set up an independent study so that the work that they've done results in a publishable manuscript.
That's fantastic. So that's the educational types of opportunities, but then there are still the research areas as well. What about the research activities?
I am funded for various large grants. One of them is looking at human behavioral aspects of dengue transmission and prevention. Another one is looking at using behavioral economics approaches to increase participation in fumigation campaigns to prevent Chagas disease. And another one is looking at implementation science to affect change in the systems to improve cervical cancer and to reduce cervical cancer. And all of these are research funding that I've obtained, and I try to integrate students who are interested in these topics into these projects.
That's great that you have funding for these projects. Or what about funding for students that go on in these experiences?
So it depends on the grants and the funding. And for some grants, I have more flexibility to be able to hire a student. A lot of times, my biggest mission is really to help and assist the students find internal funding at Tulane, since there are various pockets. One of them, for example, is the Sloan Center for Latin America Studies that often funds students to come down to do research in Latin America during the summer. Another source of funding might be the Minority Health International Research Training Grant. So we look for different opportunities for them, and then I assist with that process if I can't fund them myself.
Well, did you know that my student worker in the office went with MHERD for this past summer, and
Yes.
she had a fantastic experience.
Yes.
So it does sound
Glad to
wonderful.
hear.
Well, I'm sure it's really helpful if you're fluent in Spanish, but is it necessary or required?
It is not necessary, but I find that if students are not fluent, it is limiting for them because then they're unable to do the exciting community work that they often want to do when they come to Peru. So if students are fluent, they can be much more engaged in the activities, not only of the community, of the research, but also even integrating to the activities in the office.
Definitely more meaningful of an experience then.
Yeah.
Let's talk a little bit about you. So how did you come to work for Tulane School of Public Health and Tropical Medicine?
Well, Tulane has an amazing reputation in international health, and it also has an excellent reputation for being field-based and for a lot of the work being in the communities. So I wanted to be involved. That's one. The second thing is that Tulane's history is very closely linked with Latin America and Central America particularly. So as a result, Tulane also has a wonderful reputation in Latin America, and so it's exciting to be here.
Well, then it's great for you to have that connection, but being from Latin America,
yep.
And then working here with us, which we have a strong connection.
Yeah, it's amazing how many Tulane alum I meet in Peru. Like when they find out I teach at Tulane, they tell me that they graduated from the undergraduate or a master's program. So it's a very global community.
It is. Well, what do you enjoy most about working here in this building?
Tulane School of Public Health it's a small school, so I find that we know each other. It's a small faculty. It's a very collegial group of people. New Orleans is a fun place to be. I have always told people that New Orleans is about as close to being and living in Latin America as you can be within the United States. And finally, and maybe most importantly, I find that after Katrina, the people who have decided to come back or to stay in New Orleans, or the students who decide to come to New Orleans, are people who are interested in rebuilding the community and being part of the reconstruction of the city and the development. And I think it attracts a very unique group of individuals.
I think that's definitely true. I see it all the time. Well, Dr. Paz-Soldan, thank you for joining us for today's interview. I really enjoyed having you here.
Thank you for having me, and I do want to use this opportunity to encourage people here at Tulane who are interested in looking at opportunities either in Peru or Latin America to contact me, because that's what I want to be able to do.
Fantastic. I will share your email address on this post.
Great.
Thank you, everyone.
Bye-bye.
Bye-bye.